This video is about long QT syndrome, a condition that can affect the heart. Over the next 15 minutes, this video will provide an overview of what long QT syndrome is, how it is diagnosed, and how it can be treated.
Hello, my name is Dr. Shubayan Sanatani, and I'm a pediatric cardiac electrophysiologist in Vancouver at British Columbia's Children's Hospital. I specialize in the care of children and families with abnormal heart rhythms or arrhythmias. Today we're going to talk to you about long QT syndrome. Long QT syndrome is a condition that can cause sudden unexpected death in young, apparently healthy individuals. We're going to tell you a bit about what causes long QT syndrome and some of the treatment and management options.
In order to understand long QT syndrome, one must first understand how the heart works normally. The heart has 4 chambers, 2 that collect blood, the atria, and 2 that pump blood, the ventricles. Each heartbeat is set in motion by an electrical signal from within the heart muscle. The heart is made up of billions of heart muscle cells that contract to allow the heart to pump the blood the body needs. The electrocardiogram, or ECG, is a graphical picture or tracing of the heart's electrical activity. It is traced with electrodes attached to the surface of the body. Long QT syndrome was named because of the abnormal appearance of the QT interval on the ECG. Now that we have an understanding of the heart's purpose and how the electrical impulse passes through the heart, we can continue on to our discussion of long QT syndrome. Long QT syndrome can be inherited or may be acquired because of some other health condition, such as medication or illness. Long QT syndrome is primarily caused by an inherited genetic variation or mutation. Each cell contains a copy of the person's genetic plan, called the genetic code. This code tells the cells how to make proteins that are responsible for different systems and functions in the body. A person's genetic code determines how they look, the color of their hair and eyes, how tall they are, and even the shape of their nose. Each person receives one half of their genetic code from their father and the other half from their mother. Variations in our genetic code make us unique. Because we inherit our genes from our parents, members of the same family share these variations. Most variations are harmless, but variations that make a gene faulty are called mutations. Inherited long QT syndrome has an incidence of 1 in 2,500 in the general population. Most inherited LQTS conditions carry a 50% or 1 in 2 chance that a person with the condition will pass the condition on to their children. In long QTS, there is a variation in one of the genes regulating the cells of the heart muscle. This variation mutates the shape of one of the ion channels and slows the flow of ions such as potassium out of the heart muscle cell. This change lengthens the time needed for the heart to conduct another current and makes the QT interval longer on the ECG tracing. Experts in the study of inherited arrhythmias have discovered more than 13 gene mutations that can cause long QT syndrome. However, 90% of long QT mutations occur in 3 common genes. Under normal conditions, the heartbeat in the presence of long QT syndrome is not mechanically different from a normal heart, despite the difference in electrical activity. At rest, both hearts beat normally. Under certain conditions, for example during exercise or stress, the heart with prolonged QT may be susceptible to a life-threatening irregular rhythm in the ventricle of the heart. When the QT interval is long, the heart muscle may be unprepared to receive another electrical current, and the heart may start beating very quickly. This very rapid heartbeat is called torsade de pointe. The heart is beating too fast to pump enough blood to the brain and may cause fainting, seizures, or in severe cases, cause the heart to go into cardiac arrest. For those with LQTS, exercise and stress can be triggers for life-threatening arrhythmias. Swimming is a common trigger for events in LQTS-1. Loud, startling noises and stressful situations can trigger LQTS-2 events, and LQTS-3 events usually occur at rest.
It is important to remember that long QT syndrome may not have any symptoms associated with it at all. Long QT syndrome may be diagnosed based on an ECG done for other reasons, or if a family member is diagnosed with long QT syndrome.
Symptoms that patients may present with include fainting, seizures, or cardiac arrest. Fainting is a common complaint and can be caused by a variety of medical conditions. However, fainting or seizures associated with exertion or swimming, or because of a startling noise, is a signal for more investigations for long QT syndrome. If a family member has died suddenly without a known cause, LQTS is an important consideration. Some cases of sudden infant death syndrome, or SIDS, can also be due to LQTS. Research is discovering that as many as 15% of SIDS cases may be caused by LQTS.
It is important to take a very detailed medical history to diagnose long QT syndrome. The physical examination and echocardiogram are usually normal, and sometimes multiple ECGs are required. It is important that the ECGs be interpreted by a trained specialist in heart rhythm conditions. Genetic testing is increasingly playing a role in diagnosing long QT syndrome.
Genetic testing is done by screening a sample of blood for mutations in the genes associated with LQTS. Genetic testing became commercially available in 2004 and is now more accessible and affordable. However, approximately 1/4 of patients with a diagnosis of long QT syndrome on their ECG will not have a genetic mutation identified on genetic testing. Often families have several members diagnosed with a mutation. It is therefore advisable to screen all first-degree relatives of someone diagnosed with long QT syndrome. Research and study of this condition continue to search for a better understanding of the risks associated with these gene mutations. Once LQTS has been confirmed, management and treatment can be determined. Most individuals manage very well with LQTS by maintaining a healthy lifestyle through diet and exercise, taking prescribed medications, and knowing the possible triggers of an arrhythmia. Medications in a class called beta blockers are the most common treatment choice. They are the most effective medication in the treatment of long QT syndrome, especially in long QT1 and long QT2. These medications have names like atenolol, metoprolol, propranolol, and nadolol. These medications block the response that the body has to the hormone adrenaline, which is produced when a person is excited, exercising, or frightened. This will reduce the chances of an arrhythmia by reducing the effects of adrenaline on the heart. All medications can cause side effects, especially when first started, but will usually lessen with regular use of the medication. It is important that the prescribed medication is taken as directed. If the medication is suddenly stopped, it can raise the risk of an arrhythmia. Since treating long QT syndrome with beta blockers, the rate of sudden death has been dramatically reduced. Potassium is the main ion involved in LQT1 and LQT2, and potassium supplements may be prescribed in addition to beta blockers. A small group of people with long QT syndrome continue to have symptoms despite taking beta blockers and following the advice of their cardiologist. Other options for these people may include an implantable cardioverter defibrillator, or ICD, a permanent pacemaker, or a left cardiac sympathetic denervation. These options are determined on an individual basis and should be considered carefully with a cardiologist. Some find therapies such as reflexology, massage, homeopathy, and chiropractic treatments helpful. A cardiologist should be consulted to determine if the therapy is safe for LQTS, as naturopathic and other remedies are also drugs and can react with beta blockers and other medications. Some treatment guidelines for LQTS suggest avoiding competitive sports and strenuous activity. However, physical activity is an essential part of a healthy lifestyle, and it is now thought that activity levels should not be as restricted. Most importantly, those with LQTS should not be forced to continue an activity if they are feeling unwell. They should always be allowed to stop and rest when they feel the need. Swimming is one of the specific activities that can trigger arrhythmias. People with long QT syndrome need close supervision in and around the water so that people and equipment are available to help if an episode should happen in the water. Eating a well-balanced diet to maintain a healthy weight is also important. Potassium-rich foods such as bananas, orange juice, tomatoes, spinach, squash, potatoes, broccoli, and raisins can be added to a balanced diet. Some people avoid caffeine found in coffee, tea, colas, and high-energy drinks. Avoiding drugs that prolong the QT interval is a very important precaution for all those diagnosed with long QT syndrome, or those who are suspected of having long QT syndrome. There are medications that make the QT interval of the heart even longer, increasing the chances of a dangerous arrhythmia. The list is always changing, and it is best to check the updated version on the website qtdrugs.org. The list should be checked before taking any drug, including over-the-counter medications. Pharmacists, dentists, and physicians, including surgeons and anesthetists, must be made aware in any case of LQTS. Education and awareness are the most important aspects of LQTS management and treatment. Potentially loud and startling events should be avoided. Doorbells and telephone ringers should be set to low. Phones and alarm clocks should be removed from bedrooms. Some people avoid scary movies or frightening amusement rides to avoid the risk of being startled. Family members and friends should be encouraged to maintain up-to-date cardiopulmonary resuscitation or CPR training. A medic alert device or similar notification is also advisable. Because a healthy, active lifestyle should be encouraged, familiarity with the location of automated external defibrillators, or AEDs, in the community is advisable. For school-age children, a discussion with teachers and administrators is often needed to dispel misunderstandings and provide guidance. Because many individuals with long QT syndrome live life without symptoms, it can be difficult for them to accept their diagnosis and follow the medical advice of their doctor. Writing down questions and discussing concerns with healthcare providers can lead to a better understanding of the condition and compliance with medications and lifestyle guidelines.
We hope you have found this video about long QT syndrome informative. Remember to talk to your healthcare provider if you or a family member has been diagnosed with long QT syndrome. There are additional resources available at the end of the video. Thanks for joining us.